Hey, thank you so much for joining us for this edition of National Council Conversations. And today we're going to talk about one of my favorite topics, CCBHCs, and specifically about recent data that's been released by the National Council in our CCBHC Impact Report that tries to illuminate the kind of work that CCBHCs are doing in communities all over the country. I'm so pleased to be joined today by two great people. Rebecca Farley-David, who's a senior advisor here at the National Council, but we know her as our CCBHC whisperer. And I'm also joined by Andrea Richardson, who's the executive director of the Bluebonnet Trails Community Services. Their agency serves over 8 counties in Central Texas, providing critical services for people with intellectual disabilities, mental illness, and substance use disorders. Thank you both for being here today.
Thank you, Chuck.
Great to see you both.
So Becca, why don't you maybe give us a little bit of sense of some of the data that's in the impact report? What are we seeing around the country as a result of implementation of the CCBHC model?
Sure, happy to. So for any who might not be familiar, the CCBHC model has been in effect since 2017. It began in 8 states with 66 clinics and has since expanded today to cover 340 clinics in 40 states. So there's been phenomenal growth of this model over time, and our impact report was really designed to uncover some of the successes and benefits of the CCBHC model in the communities where it exists. We found from the impact report that the model is allowing clinics it's providing them with a financial foundation to make a lot of advances in expanding access to care, decreasing wait times, investing in their workforce, expanding access to medication-assisted treatment, and much, much more. I'll call out just a few highlights for you. So the National Council estimates that the CCBHCs across the nation are serving an estimated 1.5 million people. On average, that's about a 17% increase compared to prior to CCBHC implementation. And in that way, we're seeing how CCBHCs, by bringing more people into care, are able to start closing some of those gaps in unmet need in their communities. About 50% of CCBHCs are able to provide same-day access to care, and 93% of CCBHCs can see clients within 10 days. Now that compares to an average wait time of about 48 days nationwide. So not only are they seeing more folks, they're getting them into care faster, which we know is critically important for engagement in treatment and improved outcomes.
Thank you so much, Becca. So, let's take this moment to ask Andrea a question. Sometimes folks like us can be accused of like having our heads in the clouds. But Andrea, you're on the ground. You're serving communities across Central Texas. What was kind of appealing to you at agency about becoming a CCBHC?
That's such a great question. And Becca, thank you for the analysis for the impact report, because it is so much more. I think for Bluebonnet Trails in particular, when the Texas Health and Human Services Commission and our Texas Council of Community Centers came to us and said, hey, we have an idea of what might help sustain the 1115 progress. And of course, I'm speaking about the Medicaid 1115 transformation waiver. Before they could get the question out of their mouth, we said we're in. It's a matter of looking at what's next in our system of care and how to progress not only as a compliance element, but as a practice and a culture change that allows for immediate access to care with regard to the needs, specific needs of persons that we serve. So this was an extraordinary effort to not only get services on the ground and make sure that they were meaningful in our communities. It was a way that we could sustain that impact and that momentum from the 1115 waiver.
Well, that makes a lot of sense. And, Becca was sharing with us some of the great data about the changes that we've seen in centers. How would you say that services have changed at Bluebonnet since you've gone down this CCBHC route?
Most extraordinarily, we were able to expand access to certain services that were very key in our areas. In particular, services for substance use treatment, for veteran services, and for justice-based services in our courts and in our jails. But the key component that allowed us to really explode as the CCBHC has been care coordination. It has not only allowed us to serve more children and adults in Central Texas, it has also connected us in ways we have never been connected as tightly with our community resources and partners, with our emergency rooms. We have not only that immediate connection for service, we're able to follow that person, that adult or child, through care and connect them not only through Bluebonnet Trails, but perhaps into a primary health care setting that is different from ours. So it's just a matter of really bolstering everything that we're doing in our communities through confidence and also through partnerships. It's been an extraordinary effort to grow.
So Becca, I'm curious, is Andrea's experience in Central Texas unique, or are we seeing the same kind of thing in other parts of the country?
I think your comment about care coordination is such an important one that we are seeing across the entire country. We're seeing CCBHCs partnering in new ways with community partners who maybe they had relationships before, but now they're able to strengthen them. They're able to devote new staff resources to those partnerships. They're able to deliver services outside the four walls of the clinic in tandem with those partners to reach people where they live or work or play. So certainly, although you are an exemplary example, this is a trend that we see across the nation among CCBHCs.
Gosh, I remember back to some of the early work we did with the mantra always was we should have the financing should support the clinical model. And what I'm hearing from both of you, right, is that that CCBHCs give us an opportunity to do that. We've known for a long time that people with mental illnesses and substance use disorders touch many systems, and they need support in all those different places, but it's just been difficult to do that financially. And now we have a model that allows that to happen. Andrea, I was also struck before the recording started, you talked about how CCBHCs have really allowed you to integrate services, and that's a real big buzzword right now. Do you want to talk about what does that look like for your agency?
Thanks, Chuck. And it has been an extraordinary experience. Before, when persons walk through the door, we typically ask certain questions and then push them into a certain system of care or a program type. But with CCBHC, we look at the broader scope of the individual. We know that persons don't walk through our doors with a single diagnosis. And CCBHC allows us to not only look at those traditional things we think of in integrated care, the integration of primary health care and behavioral health care. We have also added our disability services to that line and our ability to use our autism professionals. There's an interconnectivity that allows for a person-centered recovery plan that's interwoven by professionals across our entire scope of care, which is extraordinary when you have an early childhood interventionist working with an adult because they have a specialty in nutrition. So this is just a great way to lift up our staff who understand the impact of what they do. It broadens the scope of our reach, and it serves great gaps in care in our communities.
Well, thank you. And Becca, I think you've talked to me previously about the kind of excitement you hear from clinical teams in CCBHCs about how the payment model really allows them to approach care differently. Do you want to say anything about that?
A couple of years after the launch of the demonstration, I heard from a clinic in Pennsylvania that was relating to me something one of their psychiatrists had said. And they said, who wouldn't want to work in a CCBHC? This is the best gig I've ever had. And she was commenting, when have you ever heard someone say that about working in the safety net? And so, I think we're definitely seeing across the nation increased staff satisfaction as staff are able to practice and collaborate with one another in new ways that are freed from some of the financial constraints of traditional fee-for-service billing.
Yeah. I mean, isn't it great, though, that we could see the synergy that financing can support a clinical model, which then makes staff excited. Also, Andrea, you use that term person-centered care. That's what we all want, right? And that you're able to organize that and deliver it. All right, so I know we're all excited about CCBHCs, but Andrea, what are you hearing in your community? How are your community stakeholders reacting to Bluebonnet Trails now, and what have they commented on?
I think the most fun part is that we're invited into conversations. When we used to be considered just the safety net, we're now considered a partner who may have some input into these practices. Most recently, we have been involved in our 911 dispatch. We are embedding a mental health professional in 911, which fortifies that preventative measure for a community system. So we're thrilled by that. We are also involved with court-based services. Through our care coordination, we are making sure that we have professionals that are tying to children in care, our veterans, our drug courts, and those key components that really require confidence in a treatment plan, and in this case, a person-centered recovery plan that not only provides a moment of time for that individual to be successful, but for a court to have confidence that there is a plan in place and the individual will be successful in the community. So there are some great conversations underway, and it is because of this growth through CCBHC for us.
Well, that's so great to hear. And Becca, I think you would have similar stories to tell, right? That because of the success that CCBHCs are having on the ground, that we have excitement across the continuum. I think you were talking about, maybe it was the National Association of Counties, that they're excited. And I'm sure there are other folks like that too. And isn't it great to have a solution? What we hear about so often are the problems. And I love the fact that people are experiencing this as a solution to some longstanding challenges. So can I just say thank you to both of you? What a pleasure it's been to have this conversation, to share good stories, and to think about the opportunities that CCBHCs present for communities, states, and our country. Just so happy to have had this time with you today.
Thank you, Chuck. Thank you, Rebecca.
Chuck.
Thank you.